would like to ask your both permission to use this video for educational purpose and on internet.
Right.
Now,
Yes.
you made a little bit of a medical history. You were the first patient I did OLLIF in Minnesota, and as a matter of fact, in the whole this region, you were the first patient who received the OLLIF procedure. Meanwhile, I have done over 1,500. Last week, the doctors from United Kingdom, Ecuador came and learned this procedure from us. And every month, people come from the United States and other countries. And we have achieved a truly very unique procedure that has reduced the risk of the surgery tremendously. Mm-hmm. And I hate to say that, but the OLLIF you received 10 years ago is not the same OLLIF we do now, because we have a whole engineering department. We have improved on that tremendously. So you got the OLLIF version 1.0.
Version 2.
Now we are version 7.
Oh, really?
We have come a long way.
Wow.
Yeah.
In 10 years.
Wow.
In 10 years. 10 years is a long time. But do you remember that surgery?
Oh, she does.
She does?
And I remember that smile on your face when you came out of the emergency room looking for me in the waiting room, and you were just, everything went great, you said to me.
Yeah.
Your wife went through great, and I'm just so happy.
I was ecstatic about that. Do you know why? Because I was used to do that surgery in 4 or 5 hours, and I could do that and with certain amount of blood loss. I did your surgery in less than half of the usual time.
Yeah, I remember it wasn't very
It
long.
wasn't very long.
And we had 1/10 of the blood loss of the open surgery.
Wow.
And this is one of those moments in the history that you see something very special and you recognize it. That was my happiness was about recognizing that, we did something special that day.
Right.
And that started the process. Now people, like last Friday, people flew from other states to get this procedure when they couldn't get a regular surgery in their place. Yeah. And people come even from other countries now to get this procedure for us. Surgeons come from entire United States and other countries to learn this from us. So, well, thank you for helping me to...
No problem. I hope this one goes just as good.
Yeah, but now we are going to talk about your situation. This is what we did 10 years ago. We did what we call interbody and posterolateral fusion with transcambing OLLIF, and where we did the surgery, bone is beautifully growing. At that time, I used what we call a plastic cage or spacer. That's why you don't see that spacer itself, but then we put screws in, and everything went well, and bone is beautifully growing in both places. But about a year ago, or maybe 6 months ago, something like that, you and I, we talked about that there are some other problems with your spine. Now,
my SI joint, right?
Yeah, well, with all the things that I could do, I could not stop the time and I could not make you younger.
Right.
And this is what we did. Last time we fixed these two, they are good. Mm-hmm. And then you have symptoms that could be both, could be sacroiliac joint or lumbar spine. And if you look here, you have problem in both. Here, that's the L5S1, and these are sacroiliac joint. And most of the time, both are the problem, but the way we figure out which one is giving you most of the problem is with injection.
Right.
So how many injections did we do?
3.
3. And tell me about the result of that injection.
The first 2 didn't do real good, but the last one, which was 2 weeks ago, did great for the first 3 days.
Yeah, and that is sometimes, what we say, you have 2 problems, but the injection showed us that even though you have as well both sacroiliac joint and L5S1, nevertheless, the sacroiliac joint is not really your major problem, because if sacroiliac joint was your major problem, each injection would make it day and night.
Yeah. Okay.
So you have what we call adjacent segment disease, meaning that the level we did the surgery are good, and now the other level is the one that we have to do surgery. Now, 10 years ago, I could not have done that surgery minimally invasively.
Okay.
But now I can.
Now you can. Okay.
So because we are not doing OLLIF 1.0, we are doing OLLIF 7.5.
Wow.
Many, iteration, many, much more experience. So we have come a long way. So
Super.
Practically, it is good that we bought you 10 years time, because now we can do the second surgery as well, minimally invasively.
Yeah,
I see that
that's
now,
right,
yeah.
right, okay.
Yeah.
Well, so tell me about how did you do? I mean, how long did you stay in the hospital? At that time, I used to keep the patient a long time in the
I
hospital.
had surgery on Tuesday and I went home on Friday.
So Tuesday to Friday, 3 days.
Yeah,
Now most of the patient after that surgery go home next days.
okay.
So
Oh, wow.
because we are even better at managing, we understand how to manage the pain, how to ambulate the patient.
Yeah.
Now, how long after that surgery did you return to usual life activities?
Oh, that I don't remember.
Oh, it was
It wasn't that long,
month,
maybe a
wasn't that
month, 6 weeks, maybe.
Yeah.
max,
And-
6 weeks max.
Yeah, and that was unbelievable then, and
Yeah.
it's still unbelievable. Most of patients after a 2-level fusion, it takes them somewhere between 3 and 6 months to return to
Okay.
usual activities. So even then, that was part of the big smile I had, that
Yeah.
because I knew something is going to be different. Okay,
Super, yeah.
now
We've bragged you up quite a bit over the
thank you.
years.
Yeah.
Well,
that-
thank you so much.
That we requested you.
Thank you.
We suggested you because of the outcome.
Yeah.
First
We've been
time.
100% satisfied.
Well, this is 10 years later. We are going to fix a different problem.
Yes.
And we will fix it. And now I really want I really want people know your story, because you helped me to make medical history by trusting being my first patient
Right.
to do this kind of surgery.
Oh,
Okay, well, thank you.
You're welcome.
Wow.
Well, thank you very much.